Hi, my name is LaTonya Perry. I am a nursing director here in the Houston area. I work in one of the largest facilities, hospital facilities in the world, here in the Texas Medical Center. I myself have been a nurse for about 22 years now, so I have history at the bedside as an ICU nurse. I'm also a nurse practitioner, so I do teach and I provide care as a provider as well. Here inside the hospital, I do have experience as a wound care nurse, so I typically know how to take care of the skin for a lot of our patients. I have a 24-bed ICU. I also have a 12-bed IMU. So typically I go around and I check on our patients quite often. One of the reasons why we started to use the Cavilon Advanced one was because we had some issues with our central line dressings remaining intact. For many years, for the past few years, we have used the Cavilon Advanced one with our MASD. So when we found out that the quality department was stating that we were not having our dressings were coming up and they were not remaining intact for 7 days, we decided to partner with our clinical specialist with Solventum, who came in and said, hey, you can use that Cavilon Advanced. First couple of days we put it on one of our patients. It worked tremendously well. The central line dressing was intact. About 4 days later we used it again. That same dressing remained intact. About 5 days later I reached out to our clinical specialist and let her know, hey, this dressing is remaining intact. So we decided to expand our action plan. I want to say about 2 or 3 more patients. We did that. Those dressings remained intact. So we decided to educate our entire team to use the Cavilon Advanced wand. So our team now grabs our central line dressings. We grab that wand. It has really been working well. After our initial period of using the Cavilon Advanced, our clinical practice has changed tremendously with our nurses, our bedside nurses, also our bedside nursing assistants, because this is a daily, we use the Cavilon Advanced daily. So whenever a nurse needs to go in and change her central line dressing, she usually grabs a central line dressing and she also grabs a Cavilon Advanced wand. And so those two integrate together. So we change central line dressings once every 7 days. And so we've only had to change our dressings since we've gone to this practice once every 7 days. There may be some outliers if a patient is bleeding or so out of their central line, and we have to change the dressing a little bit more often, but typically we don't. Once you apply that Cavilon Advanced, that dressing stays intact for 7 days. We have about a 90% success rate from our quality department here, with our central line dressings remaining intact since we started using it about 9 months ago. One of the positive things that we have received from our nursing is that, hey, we don't have to change our dressings quite as often. They were changing them about 2 or 3 times a week. When they flip and turn and move their patients, even when they get their patients up to walk, they don't have to change those dressings when they get their patients back to bed. So it's definitely a pleaser with the nursing, on the nursing side. On the leadership side, I am very pleased because you don't have to open up in your central lines, because with the opening and the closing of your central lines, you put your patients at risk for infection.